Patnaik, thank you so much for coming and spending a few minutes with us so you can share things about you and your journey. We appreciate your coming to the polls meeting, being first of a kind by onecell.ai. And so I think my first question is if you can just share, or rather, information about your name and your affiliation, and also what took you to the journey to do your medicine.
I'm Dr. Jogmaya Patnaik. I'm actually working at KIMS Cancer Center in Bhubaneswar. I'm a medical oncologist. I have almost a decade of experience in medical oncology. And I'll say that the journey as a medical oncologist has been very fascinating and it has been very enriching. And day by day, with the arrival of newer technologies, it is actually very interesting to treat patients in newer ways, with newer form of treatments, with newer form of diagnostics available, uh, giving or providing better clinical benefit. So the journey has been really very fascinating and very satisfying. I'd say that.
That's wonderful to know. Is there any particular example for patient that you have used classical methods of diagnosis or treatment that you can share with us?
Uh, Actually, we have been using both classical methods and both newer techniques like precision oncology in our clinical practice. Currently, it is the era of precision medicine. So, what is the particular type of cancer and the patient is harboring that type of cancer? We have to treat the patient as well as that particular type of cancer. There comes the uh, evolution of precision medicine, because previously we were treating the whole patient. Now we are treating the genome of the patient. So we are targeting the genome now. So we have been we have been just trying to move very centripetally. So therefore, it's now coming from the whole body to one cell now. So therefore, diagnostics really matter. And with NGS platforms like OneCell, along with the addition of AI and the AI empowered database, and this actually helping a lot to make good clinical decision and give good treatment options. Actually, a lot of treatment options are available, but if we don't know that what treatment we can use for a patient, uh, even if that treatment is available, we cannot use that if we don't know that it is applicable. So there comes the integration of diagnostics and therapeutics. So that is very important now. It was not having that much of clinical implication, I would say 10 years back. But now actually we are moving to a era where we will diagnose that this is not a lung cancer. This is this mutation positive cancer, this mutation positive lung cancer. So definitely it is going to be very challenging for us and very interesting for us to look forward to this kind of future.
That's a fantastic, way you explained it. It's really nice. And I think you also covered my next question, which I was going to ask you about technological advancements. So it looks like science with the data science all combined together really provides you a lot more information to make better treatment, informed treatment decisions,
Informed treatment
patients,
decisions.
and also very targeted. So you are treating exactly at the point of where the cancer is to the patient. So thank you so much. This is wonderful talking to you. And we hope that, you'll continue to be working with us, and also very exciting about the way you're treating patients here too. Thank you so much, Dr. Patnaik.
Thank you.